Delayed diagnosis caused by either missed or delayed annual checkups or preventive screenings because of COVID-19. The evidence is already coming in, and the numbers are staggering. Deaths caused by heart attacks or stroke went up by 40,000 each year compared to before the pandemic. And for some who have chronic conditions, the situation could actually be much worse. But there is hope. We can check the rising tide of disease by getting back on track with regular medical exams and screenings. We're going to talk to a panel of experts next on preventing disease and staying healthy.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Welcome to the Preventing Disease and Staying Healthy Town Hall. I'm Olga Villaverde. If you missed your regular exams and tests during the pandemic, you are certainly not alone. We are here to talk about what you need to know to get back on track and preserve your health for the future, because that's what we want. I want to introduce our wonderful panel of experts today. We have Dr. Kelli Tice. She is the Vice President of Medical Affairs and Chief Health Equity Officer for Florida Blue Insurance. Also, we have Dr. Michael Zinner. He is the CEO and Executive Director of the Miami Cancer Institute. He's also the founder of Harvard Center for Surgery and Public Health. We also have primary care physician Dr. Kamaljit Kaur at Baptist Health Medical Group. And finally with us, Dr. Jorge Castellanos, an interventional cardiologist, Harvard Medical School trained, who practices at the Newport Heart Medical Group in Newport Beach, California. I want to welcome all of you and thank you so much for joining us tonight.
Thank you, Olga.
I'd like to let our viewers know that if you have a question for our guest, please email it to us. It's so easy. questions@allhealthtv.com. You see it right there below on the screen. That's questions@allhealthtv.com. We're going to get to your questions, as many as we can in the next hour. So let's begin our town hall. Many people delayed or canceled their annual exams and screenings. And even now, many people have not even seen their doctors. And that's causing a delay in diagnosing some serious but often preventable diseases. Dr. Zinner, I'd like to start with you. In an op-ed for USA Today last fall, you called this problem a time bomb waiting to explode. You said the outcome would cause a dramatic increase in medically complex cancer cases over the next decade. And there is your quote right there. What prompted you to sound the alarm? It was a foreshadowing, if you will.
You know, Olga, I had been looking at the data that was coming out of NIH and looking at the data coming out of the CDC and realized that we were talking about as much as a 90% reduction in women getting mammograms and in about the same number for colonoscopies for screening for colon cancer. And it looked like over the next decade, we were going to have up to 10,000 unnecessary deaths because of these delays in diagnosis. And so I described in the op-ed piece, this is a ticking time bomb with a 10-year fuse. And now, as we're coming out of COVID, it's time for people to get back to see their doctors. It's time to get back for these screening tests because it makes a difference in who's going to be seen early. In medicine, time is of the essence in every disease we treat.
Thank you, Dr. Zinner. Dr. Tice, I'd like to get your thoughts on this. Do you believe this has caused a public health emergency?
Absolutely, yes. I certainly agree. It's time to sound the alarm. As an insurance company, one of the things that we do is monitor our members' health and health behaviors through what we see happening with our claims data. And we saw a decline in these screening examinations, a significant one. And while we are seeing a resurgence, we never really saw an increase that indicates a return to care for all of those who delayed care. Now, folks understandably withdrew themselves from care. Some were fearful, but we were already working very hard to address delays in care for certain segments of the population. And now my fear is that what Dr. Zinner describes as the 10-year fuse on the time bomb, it will inordinately affect minorities.
And we're going to talk more about that, Dr. Tice. I'd like to share some numbers that are pretty shocking, to say the least. Let's look at this real quick. Deaths caused by heart disease or stroke up 40,000 each year of pandemic. Black adults are 30% more likely to die from cardiovascular disease. 5,200 new cases of cancer diagnosed each day in 2021. I mean, these numbers are just staggering. Dr. Castellanos, let me get your thoughts on this. As a cardiologist, this must be a major concern.
Hi, Olga. Yes, absolutely. I mean, I want to echo the sentiments of the rest of the panel. In cardiovascular disease, there are a lot of things that we can do that are have immediate implications, but a lot of the care that we provide is to help prevent disease 10, 15, 20, 30 years down the road. And what we've noticed is a significant number of our patients have failed to come for follow-ups. And even more so, after they get discharged from a hospital, they're very hesitant to come into the office. So I worry significantly about their health moving forward, when we know that so many of these cardiovascular deaths could have been prevented with appropriate treatment early on.
Dr. Kaur, I mentioned off the top that many patients have seen their doctors. Your message to those who procrastinated and put off their visits because of the pandemic?
My message would be to come in. It's better late than never. Those screenings are still readily available. They're ever so important. And as you mentioned, they're going to have significant benefits as far as screening early and diagnosing early and treating early and potentially curing early.
Dr. Tice, this brings up a video I'd like to share with our viewers that you recently did for Florida Blue about the importance of keeping up with your doctor's visits, especially if you have an existing health condition. Let's take a look at it, and we're going to talk about it right after.
It's important now more than ever to make and keep doctor visits if you have an existing health condition. If you've been putting it off or had to cancel or reschedule an appointment due to COVID-19, talk to your doctor about getting back to your care appointments. This is particularly important if you have a condition like asthma, COPD, or another lung disease, heart disease, uncontrolled diabetes, severe obesity, a weakened immune system, or sickle cell disease. Monitoring an ongoing condition and staying in touch with your doctor can help keep your health on track. And many times, you can do it through a virtual visit to keep you safe at home. Get in touch with your doctor today to schedule an appointment and take good care of yourself.
Take good care of yourself. Dr. Tice, what a great message, and what an important message to get the word out.
Certainly, our mantra through the pandemic has been take good care. We have had to empower individuals to take responsibility for their health, to make good health decisions, and to become informed about what risks exist for them and what they should do in order to try to manage those risks. Now more than ever, we hope that folks hear the message of getting back on track and doing so confidently, not being fearful about what they might discover, but being confident that getting your health back on track will actually give you the longevity and the quality of life that everyone is intended to have, I believe.
Because the repercussions can be sometimes so unfortunate. And here on the Health Channel, we always talk about catching a disease in its early stages and how this can save lives. That's why having regular screenings and exams are so important. Dr. Zinner, I want to share a personal story with our viewers, and then I'd like your feedback. One of my good friends is currently being treated at your institute, Miami Cancer Institute. She didn't get her mammogram in 2020 or 2021. This year, unfortunately, she was diagnosed with stage 2 breast cancer. And that's just one of many stories that I hear. We're going to see the effects of what was not done in the last 2 years, aren't we?
You know, Olga, I'm afraid we are. What our concern is where I live, which is in a cancer institute, is that we're not only going to see the effects, but we're going to see more advanced disease coming to us at a later time. There's a recent survey by the Radiation Therapist Societies, and there was unanimous decisions that they're seeing disease at a later stage because of delayed diagnosis, because of delayed screening. So I emphasize again to our audience and to all those who are listening, it's time to get out there, to get your colonoscopy, to get your low density CT scans, the mammograms that need to get done. It's time to go back and see your doctor for all of those reasons.
And Dr. Zinner, people sometimes assume a screening involves a test of some kind, and some do, of course, but screenings, and let me show you this, can also mean just looking into your family history, taking your vital signs, questions about depression, your general health, imaging, scans, bone density as well. There's just so much involved, Dr. Kaur. You're a family medicine physician, often the doctor people see first. Are you seeing patients today? Are we seeing maybe an uptake in patients coming in and seeing you?
Yes, Olga. Fortunately, in the last several months, we've seen a great uptick in patients coming back in for their annual exam, patients of all ages. And that's very reassuring. And the patients that are coming, it's funny because I often will ask a patient, when was your last annual exam? And inevitably, nowadays, the answer is pre-pandemic. And they kind of tell me that in a way that makes them feel ashamed or they feel bad about it. And I tell them, listen, it's better late than never. And at least you're here. So let's see what we can get done now. And then we just reassure the patient that we're going to be doing everything that's reasonable for them at this point.
And Dr. Kaur, let's be honest, it's not that patients didn't want to go see their doctors. It's just there was so much going on with children at home, jobs, people just relearning how to do a job from home, some fear. I mean, there was just so many reasons, right?
Yeah, absolutely. You're absolutely right. It's not always the person being afraid of going into a medical facility with the risk of contracting COVID-19. Oftentimes it's because their kids were home and they just couldn't, or unfortunately, some of them got furloughed or didn't have transportation, so many reasons. But as things are picking up slowly, we're glad to see that people are taking their health more seriously again.
Which is great news. I want to turn to cardiovascular disease. It is the #1 killer of both men and women in the United States. And like other diseases we're talking about tonight, the rate of new cases is staggering. Dr. Castellanos, I know you know this, but sometimes people don't even know they have a heart problem. What are some of the hidden symptoms? I'm even going to personalize it again. I'm an avid runner. I eat healthy. My weight is pretty good. And just a few years ago, I was diagnosed with hypertension. I was completely shocked, but it was because I knew my numbers that I was able to control my blood pressure. These are problems that need to be addressed, correct?
Yeah, Olga, absolutely. So again, as I mentioned before, one of the most important aspects of cardiovascular health is realizing that if you take care of it at an early stage, you can prevent some of the significant sequelae in the future, right? So, for example, hypertension can lead to increased risk of stroke, heart failure, coronary artery disease, and those are conditions that are much more significant and much more severe than the ramifications of just having high blood pressure. But you need to treat the blood pressure now, while you're young and able to do so. What's really interesting, actually, about at least what I noticed in my practice, is that a lot of the same symptoms that people have had with COVID are analogous to the symptoms you might have with heart conditions. So many of my patients are having shortness of breath, decreased exercise capacity, and those can be what we consider anginal equivalents. Those can be equivalents of a problem with the heart. I've noticed an increase in these type of complaints, and we are doing studies and trying to figure out if there is a cardiac component to their symptoms. But what I want to stress to all of our viewers out there is that we're here to help. We're here to make sure that you are doing well. So if you have any of these conditions, more than happy to see you in the office, be able to screen you and reassure you. And if you do have heart disease, be able to manage it and take care of you from the beginning.
And this may seem like a simple question, Dr. Castellanos, but again, don't play around with that. If you feel those symptoms, do something about it, because it could be something more serious than we could even imagine.
Absolutely. I think that probably 9 times out of 10, it won't be something serious. But the reason why we're here is because we take care of that, 10%. We want to make sure that you're not part of that 10%. So yes, it could be something more significant. Chances are it isn't, but we don't want to risk that. So come see us. We can do some simple tests simple questions. Oftentimes with the history, that's enough. We don't even have to do any tests, the history and a physical exam. But come and see us, and we can reassure you. And there's lots of treatments nowadays with modern medicine to help keep you not only living longer, but having a healthier life.
Thank you, doctor. You know, we lost even more people to heart disease during the pandemic. We spoke with Dr. Donald Lloyd Jones, the president of the American Heart Association, recently about that. And here's what he had to say. Take a listen.
In a typical year before the pandemic, we were seeing around 815,000 deaths per year from heart disease and stroke, by far the #1 cause of death in Americans. During the pandemic, those numbers went up by about 40,000 each year. So again, in 1 year, we saw as many deaths due to cardiovascular disease as we saw in the 2 years so far of the COVID pandemic. So this is a major, major problem. And it in part was because people were presenting later or not presenting at all when they had an emergent event like a heart attack or stroke. But we've also seen that people delayed or deferred care for those risk factors, their blood pressure, their cholesterol, their diabetes. We see much, much lower rates of blood pressure control in people who had diagnosed hypertension because they've lost contact with their usual source of care.
Talk more about this. Dr. Castellanos, I want to bring you back because I just got a viewer question, and this is what this individual writes. My brother had a heart attack about 2 years ago, and after his last stress test, the doctor told him to go in for an angiography, even though the stress test wasn't bad. How often should you get one after a heart attack? And if you could also explain what an angiography is, doctor.
Sure. So a few quick things. Just keep in mind, in anyone who has a specific type of heart attack called an ST elevation MI, or an acute heart attack, these are the classic types of heart attacks that you see people clutching to their chest, very sweaty, significant shortness of breath. There's a 20% mortality rate if it goes untreated. And if you come into the hospital and you get treated quickly, your mortality rate drops below 1%. So significant mortality benefit if we take care of you quickly. Now, if let's say you had a heart attack and it was treated successfully and you're doing well, in general, you don't need to be doing routine stress tests. Typically, we recommend a stress test if you have any symptoms that make us as physicians concerned that you're having a problem either with the stent that was placed or maybe a different artery is narrowed. If in fact there is a concern that you do have a blocked artery, then the next step is to do something called a coronary angiogram. Angiography is a general term. The more specific term is a coronary angiogram. That's a procedure by which we advance catheters, which are like tubes, through an artery, either through your wrist or through your groin, through your femoral artery. And we actually insert that catheter all the way into the heart, into the beginning of the arteries that are called the coronary arteries that supply blood to the heart. And we can use specific agents to be able to opacify the arteries and see if there's any blockage or not. So for the viewer who sent the question, generally we don't do a coronary angiogram in a patient who has a okay stress test, but there are conditions where maybe based on the physician's clinical suspicion that the stress test could be wrong, and they would recommend doing a coronary angiogram. And if that's the case, I would follow along. The risks and complications with coronary angiograms are extremely low nowadays, less than 0.1% for any patient. So I think doing an angiogram, if the doctor thinks is appropriate, seems very reasonable.
Thank you, doctor. Continuing on with heart disease, we know it can be a killer, and that's especially true for African American women. I'd like to share this video, and we'll talk about it in just a bit. Take a look.
Living Minute, a look at the latest medical innovations changing our lives.
Heart disease is the #1 killer of African American women. Each year, more die from heart disease than breast cancer, lung cancer, and strokes combined.
African Americans have the highest hypertension rates in the world. And African American women are also the least physically active group of women in the United States.
As with so many high-risk groups, most African American women don't think they're at risk for heart disease. So education about healthy lifestyles and the importance of taking care of yourself is extremely important.
I truly, truly recommend that African American women be diligent to protect their own hearts and also to take time for themselves. So self-care really does matter.
Dr. Tice, we have a graphic here with some pretty startling numbers regarding cardiovascular disease and diabetes among Black adults. Let's look at this real quick. 30% more likely to die from cardiovascular disease, 45% more likely to die from stroke, rate of diabetes 14% higher for Black men and 13% higher for Black women, 2 times as likely to die from diabetes, 3 times more likely to be hospitalized for uncontrolled diabetes than whites. Dr. Tice, why are Black Americans impacted more than whites, not only for heart disease, but other serious diseases?
What we see, Olga, with Black Americans and chronic disease in general is the result of long-standing disparities in terms of access to health information, lack of representation or diversity in medical professionals, and underrepresentation in medical research, and a limited access to the tools that are necessary in many cases to stay healthy. The moment it became clear that COVID was having an impact on diabetics, for instance, I became alarmed because I knew these statistics existed related to Blacks and diabetes diabetes control. The fact that more Blacks are inactive, work in jobs where they are unable to take time off, attend physicians' visits, they are more likely to have difficulty with transportation. All of the things that are necessary to complete a physician's visit and to remain in care, as well as the things that are necessary to modify your diet, to exercise safely in your neighborhood. Those things, through years and years of disinvestment in Black communities, produce the sorts of disparate impacts that those statistics represent.
Thank you, Doctor. Dr. Zinner, I was reading here, and this is from the American Cancer Society. African Americans have the highest death rate and shortest survival of any ethnic group in the United States for most cancers. Your thoughts here, Doctor?
Yeah, Olga, this is one of those, in one sense, a perplexing number, and on the other hand, perfectly understandable. So for example, let's just take colon cancer. So the difference between the incidence of colon cancer in African Americans and the Caucasians is a couple of percents, like 3, 4, 5%. But the difference in mortality between those two groups is 20%. And the only thing I can think of is that it's what Dr. Tice just talked about, the social determinants of care, the things like seeing a physician regularly, transportation, getting off work, childcare, all of those things that are disproportionately affecting that underserved population. We have to do something about that to change that trajectory.
Thank you, Doctor. I have a question here from a viewer I'd like to get to. They write, my 40-year-old boyfriend had a stroke about a week after he was diagnosed with COVID. He has recovered, but he has never had risk factors or family history before. Could he have another more deadly stroke? Dr. Castellanos, I'm going to have you chime in on that, please, and then Dr. Kaur.
Sure. So, I mean, it is quite possible, right, that the stroke was related to COVID, and that we know COVID is a hypercoagulable state. What that basically means is that you're more likely to form clots in your blood vessels. And a stroke is one form of stroke is when there is a clot that goes to an artery in the brain and prevents the brain from getting the necessary nutrients to function. So, it's very possible that they were hypercoagulable from COVID, and that led to a stroke. There are also lots of other conditions that lead to strokes, and it could have been just a coincidence. Either way, plenty of things that can be done to be able to evaluate what may have been the cause of the stroke to help reduce the chances that will happen again. So it doesn't start and end with the stroke. It really it's a place where we start looking for other causes to help prevent more serious stroke that could be even more debilitating than this one.
And Dr. Kaur, obviously you are the doctor that many patients see before they go see specialty doctors like Dr. Castellanos. Your thoughts on this, and of course the importance of not ignoring blood pressure numbers, because in the long run it could have terrible effects.
Absolutely. We all know that uncontrolled blood pressure can cause heart attacks and strokes. The thing about blood pressure that a lot of people don't realize, though, it's often called the silent killer, and that's because you don't know you have it until one of these unfortunate events occurs, which again, why it's so important to come in for your primary care and annual screenings. If you notice that your blood pressure has been creeping up, then just let's have the conversation. We'll have you track it. We'll see if it's really uncontrolled, if there's any lifestyle changes we can do to prevent it. Because as Dr. Castellanos was saying, once you have a stroke, that's not the end of the story. There's a lot of ways we can prevent that secondary stroke, and it's so important to do so.
Thank you, Doctor. Dr. Zinner, another question from a viewer. Let me read it to you. My wife is a breast cancer survivor, and her doctor says she's at a higher risk for heart disease. Can you tell us what's going on, please, and what can she do to protect herself? We normally don't think of heart problems with cancer, so what's the connection here?
So there's no relationship between cancer itself and heart disease. What there is a relationship between the things we use to treat cancer and the heart disease. So, for example, there are a number of drugs we use that have a bad effect on the heart muscle. And so you have to be a little careful and very vigilant if you have had that kind of chemotherapy. The other example is radiation. So we know that women who have had left-sided breast cancer, who've had a lumpectomy and then have traditional radiation, that radiation not only goes to the breast, but it also goes to the heart behind it. And so we know that women who have had left-sided breast cancer with lumpectomies and radiation have a higher incidence of coronary artery disease and valvular heart disease. It is, by the way, part of the reason why for left-sided breast cancer, we and many other institutions have gone to treating that not with traditional radiation, but with proton therapy, which spares the heart. So to the woman who asked, it's not the cancer that caused your problem. Unfortunately, it's the treatment that cured you of your cancer. And now that you're a survivor, you have to go and get regular checkups with your heart doctor, your cardiologist.
Thank you, Dr. Zinner. Earlier, we talked about missing annual doctor's visits and ignoring changes in your health and how that can have some serious consequences. Well, look at this story now of a father who learned after putting off a checkup what would happen. Take a look at this.
Living Minute, a look at the latest medical innovations changing our lives.
As a financial advisor, husband, and father of 5, Dan Goot keeps pretty busy. So when he started having bowel issues, he didn't think much of it.
It progressively kept getting a little bit worse and a little bit worse. And that's when I had mentioned it to my wife. And she's like, yeah, you got to get it checked out.
Doctors at the Cleveland Clinic discovered Dan had more than 100 polyps in his colon and was at high risk for colorectal cancer. So he had an operation to remove most of his colon.
It's a large surgery, but we can do it minimally invasively, and people do very well with having that part of their colon removed.
Dan is now back at work and feeling great.
Probably something I should have done a long time ago is just get regular checkups.
Currently, screenings are recommended for individuals 45 and older. But if you have certain medical conditions or a family history, you should get checked out sooner.
We're going to talk about this story in just a moment, but I want to get to a viewer question because when they do send in their questions, we want to get them in as quickly as possible. Dr. Tice, this comes from James, and he writes the following. How often and how long should the patients be advised to do exercise in a week, especially those who are diagnosed with mild and moderate cardiovascular disease? Dr. Tice?
So I love the question, first of all. It was, I think, one of the things that is most important and one of the takeaways we want for the viewers this evening is not just to get engaged in care, but to identify the things you need to be doing so that you can be in your best state of health. So outside of screenings, there's some health behaviors, and exercise is one of them. Regular exercise, so 30 minutes most days of the week, 150 minutes a week is it actually reduces the incidence of a significant number of diseases, including dementia, blood pressure is better controlled, diabetes, and it certainly reduces your risk for obesity. The key, though, is if you have an existing diagnosis of heart disease, and I'm sure Dr. Castellanos will corroborate this, that you get clearance from your physician ahead of time before starting an exercise program anew. And I want to say one more thing as we talk about exercise. Often, you've seen these folks in your neighborhood, right? They're sort of walking at a fairly slow pace, chatting with a girlfriend as they do so. We really do want to get enough exercise so that you're short of breath, you can't comfortably hold a conversation, you sweat a little bit. That's what indicates that your heart rate is elevated enough to give all of those benefits that I just described.
Dr. Castellanos, would you like to chime in?
Yeah, no, absolutely. I think that exercising is extremely important, and I'm always happy to see anyone who wants to do an exercise regimen. I can tell you that unless you have something very specific, I'm going to have you exercise because of all of the benefits associated with it. So exercising 150 minutes a week is excellent. And as mentioned, you want to be somewhat short of breath. You want to be a little bit winded. That's how you get the most benefit out of it.
Thank you, doctor. Going back to that story of the father who had the colon cancer scare, there's a question coming in from Jenny, and it's somewhat similar in the same category. Let me read it to you all. I'm 46 years old and in what I think is good health, but my doctor wants me to get a colonoscopy to check for cancer. I don't have any family history of colon cancer, so do I really need one? Dr. Kaur, do you want to take that for me?
Yes, sure. So we do get this question a lot now, especially since the guidelines have changed in the last few years. Whereas colon cancer screenings were previously recommended to start at age 50, they're now recommending that we start the discussion at age 45. And just like the viewer question, patients who are considered average risk, and that means they don't have a personal history of colon cancer, they don't have a history of colon polyps, they don't have inflammatory bowel diseases like ulcerative colitis or Crohn's disease, and they don't have any genetic predispositions to colon cancer, then there are home tests that are available too. So there's different modalities that are available now. The colonoscopy is still the best because it's the only one that allows us to visualize what's going on in the colon. And the other tests, even though they're more convenient and sometimes more affordable for patients, they are not as effective as a colonoscopy, and they can have false negatives. But either way, the conversation should start at age 45, and it should be based on a person's individual risk factors and what they expect from their care.
Thank you. Dr. Zinner, your thoughts on the new guidelines and the importance behind them?
Yeah, so we used to have, as you just said, we used to have the guidelines starting at age 50 for you to get your colonoscopy. But then for the last decade, for some reason, we're beginning to see colon cancers in young people as early as their 30s. So it moved the guidelines back down to 45. And that's for a colonoscopy. Now, a colonoscopy still remains the gold standard by which we need to do screening and therapy for early detection. In fact, I'll go so far as to say that colonoscopy is the only diagnostic or screening test that we have that is also going to prevent cancer. And the reason I say that is because we've known since the 1980s that colon cancers start with a little polyp and then it grows over time and that polyp turns into a cancer. If we get it when it's a little polyp and we can see it, snare it, take it out, we're preventing you from developing cancer in the future. So we highly recommend colonoscopy as the diagnostic and preventive test for it. Now there are home tests like Cologuard and things like that. They're good for detecting, but they're not as nearly as efficient as good as colonoscopy.
And I can attest to that, Dr. Zinner, because even during the pandemic, I had questioned whether I should go get my colonoscopy. I almost put it off, but I decided to go through with it, and they found 2 polyps. So I'm really glad I took care of that. Dr. Tice, you're going like this. In other words, thank goodness, and everything turned out okay.
Well, I'm glad you did that.
Right.
I apologize, Dr. Tice.
I was just going to say that I'm a family physician myself, and the things that we recommend are the things that we know can benefit you, and a test that allows that can be curative in terms of preventing the cancer from developing, just extraordinary.
And Dr. Zinner, your thoughts?
Well, I was going to say, a lot of people don't want to get a colonoscopy because of the prep. Let me just tell you, I'd rather poop all night and never develop colon cancer than have to worry about that developing 10 years later.
I completely agree with you. And since you mentioned poop, let's talk about diet. So on that front, Dr. Tice, a recent Cleveland Clinic study showed that when children were put on one of three diets, Mediterranean diet, American Heart Association diet, and a plant-based diet, they lost a lot of weight and reduced their blood pressure and blood sugar, even if they only stuck with it 2/3 of the time. So can we talk about the rates of childhood obesity and the risks associated behind it?
Absolutely. This is so important. You know, a lot of what we're discussing in adults begins in childhood. And what we are facing in our nation related to childhood obesity truly is an epidemic. We're seeing upwards of 30% of children that are either overweight or obese, and that number actually increases as they age. So the diets you describe really have a few things in common. One is that they're low in preservatives, and they tend to cut out the things that are high calorie and low nutrient value, right? So the snacks that kids tend to have. Now, the data related to obesity really only goes through 2019. We're seeing some preliminary data through the surveys that we do, but think about what happened during the pandemic. Think about the number of children that were out of school for significant periods of time without access to regular exercise through their school physical education programs, the interruption of organized sports for a period of time. This is another thing we will have to pay for over time, and really focusing on guiding children into developing and maintaining good nutritional habits and healthy exercise is going to go a long way in reducing their lifetime risk of developing high blood pressure, high cholesterol, and diabetes.
Thank you, Dr. Tice. Dr. Zinner, I want to get back, if you don't mind, to cancer and adults. Last year, the guidelines for lung cancer screening were changed. Let's talk about that and the importance behind it, Doctor.
You know, unfortunately, during the pandemic, it seems like smoking became even more epidemic, I suspect because of people being shut in and other reasons. So the guidelines moved back to getting that screening done at an earlier age. Now we're talking about 50-year-olds who have had a history of smoking, or even those who gave up smoking over 15 years ago or within the last 15 years. And if they get a low-dose CT scan, it could save their lives. And it could save their lives by detecting small lung cancers that can be easily removed or treated. And so we've changed the guidelines again because we're beginning to see higher incidence of disease. And again, screening here just saves lives. There's no other way to say it. Low-dose CT scans in that age population, and for those who have a history of smoking, or even around those who have secondary smoke, who have a loved one or in a setting where there is secondary smoke.
Dr. Castellanos, I'd like your thoughts on this as well, please.
Yeah, so as far as smoking, it's interesting. It's one of those habits that seems to affect so many different areas of medicine. So smoking is a significant risk factor for developing coronary artery disease. And it doesn't really matter how much you smoke or when you were smoking. It causes damage to the inner lining of the cells of your vasculature. And that only leads to increased risks of coronary artery disease that can lead to heart attacks, but also heart failure and strokes. I live in California, and for the most part, smoking isn't quite as popular as some other states. But I did notice that during the pandemic, a lot more of my patients were relapsing. And I suspect it had a lot to do with maybe the stressors that surrounded it. I'm hopeful now that things seem to be getting better, that will reduce as well.
Let's hope so, Doctor. Absolutely. And with a number of serious diseases, lung cancer affects Black and Hispanics at greater numbers than whites, as this video points out. Take a look at this.
Living Minute, a look at the latest medical innovations changing our lives.
Lung cancer is the leading cause of cancer death in the U.S., and with recently updated screening guidelines, doctors hope to diagnose the disease much earlier. Screenings use a low-dose CT scan to create images of the lungs and look for abnormalities. The hope is that the new guidelines will reach more people over 50 who have a history of smoking or have quit in the past 15 years.
It's very important for us to reach patients that we've not reached in the past. For example, Hispanics, Blacks, American Indians, etc. Those patients typically have not been enrolled in these kinds of trials. They're at higher risk for developing lung cancer.
The key is to reach out to at-risk patients and encourage them to come in for the tests.
And let's take a look at these numbers. Lung cancer is the leading cause of death in Black men and the second leading cause of death in Black women. They are 20% more likely to get colorectal cancer, and Black men are 40% more likely to die. African American women are 30% more likely to die of breast cancer and twice as likely to die if they are over 50. Black and Hispanic women have higher rates of HPV-associated cervical cancer. Again, staggering numbers, Dr. Tice. Your thoughts on this?
You know, we've been talking about health disparities for literally for decades. And the pandemic has now allowed us, all of us have thrown the doors wide open, and we are leaning in full force to be sure that we solve all of the barriers that exist to that perpetuate this. So we've talked about some of the things, right? It's underrepresentation. It's, not understanding your health and how to navigate the health system. It's being underinsured or uninsured. It's not being able to be off of work in order to go to the doctor. So even if you have coverage, right, if you're not at work, you don't get paid, sort of thing. But there are other things that are at play here. We are discovering more about the implications and impact of physician bias. As physicians, we too, we operate and manage care for our patients through our own lived experience frequently. And again, because Blacks are underrepresented in research studies, a lot of what we know about disease processes, disease risk was characterized in non-minorities. In addition to that, Blacks are less likely to see a physician of similar race or ethnicity, and in fact, in many cases, tend to have interactions with their clinicians that are more, where the clinicians are more dominant, and sort of more aggressive during the physician visits, and that happens across the board. That isn't racism in medicine, right? That is often that's bias that is unconscious in many cases. So a big part of the work to educate minority communities about their own health and what is necessary for them to be healthy also involves addressing the experience that they're going to have once they walk through the clinical doors.
And Dr. Tice, since you mentioned health disparities, I'd like to show this graphic to our viewers. Dr. Zinner, I'd like you to chime in after we show it. Limited access to health care, lack of health coverage, poverty, environmental barriers, individual and behavioral factors, education inequalities, lack of provider diversity. Doctor, we talked about these numbers. What can we do to change this, Dr. Zinner?
Well, I think you've highlighted exactly what we've been worrying about and what Dr. Tice mentioned. These social determinants of care are just as important as whatever therapies we're talking about in getting out to the community. Getting out and reaching out into our underserved community is a critical part of what we do. And so I'll give you an example. At Miami Cancer Institute, we've looked at the issues of disparities in terms of cervical and breast cancer in the underserved community. And we are linking up with a program in Palm Beach County called the Promise Fund, where we're reaching out into the community to see the underserved women, and once they're diagnosed with cancer, be able to use an accelerated program that allows us to give them therapies in shorter periods of time with the same outcome and have them return to work, not take as much time off, not worry as much about transportation, not worry as much about childcare. That's a critical part of us and our responsibility in the medical field, reaching out into those communities. So I admire what Dr. Tice is talking about and support it 100%.
And I think this is something that's very important to talk about. I'd like to have Dr. Kaur and Dr. Castellanos also weigh in on this. Dr. Castellanos, you first.
So, it's interesting. Especially where I live in California, it's a very diverse state, but Orange County itself lacks some of the diversity that the rest of the state has. And yeah, I echo what Dr. Tice is saying. I think it's so important for us as healthcare providers to be aware of our own biases and how we're taking care of patients. I think one thing that I've noticed in particular is, in addition to the racial biases that may happen, a lot of my patients are Spanish speaking, and being able to provide literature or a message to them in their language is extremely important. So one thing we're trying to do is focus more, even in a small way, to have bilingual personnel, bilingual information that can be used to help inform our Spanish-speaking population. We're trying to expand that to other languages as well.
Thank you, Doctor. And Dr. Kaur?
Well, Olga, to be honest with you, as a child of immigrant minority parents, this very much touches my heart, this topic. I do believe, and I think this is the best way for me to emphasize how I feel about this, is that if my own father received the care that I believe he was entitled to and deserved, then his outcome would have been different and, to be honest, would have been here with us today. So I absolutely feel very dearly about this. I agree with the rest of the panel. I think one of the biggest things is not only to get more providers into these underserved areas and to address these disparities, but also education for the providers as well. And one of the things that I remember early on in my training was with our computer system, our electronic health record system. I saw that when I'm giving a patient instructions or recommendations after the visit, it was available in almost every language that you could think of. And that was pretty cool. And I think that's very appreciated by our patients, and it helps to improve the care that we provide them.
Thank you, Dr. Kaur, and thank you for sharing your personal story with us. Dr. Zinner, I was reading here the CDC estimates that over 30 million Americans were still without health insurance last year. 30 million. How do we get more people insured, Doctor?
You know, that's a critically important discussion that we need to have, not only with our healthcare providers, but also with our politicians, because the ability to provide health care really starts with their ability to be seen and have insurance. So that was pretty controversial during the Obama administration when the Affordable Care Act was formed. But now here we are, a decade or so later, where that is now approved by 60% of the population, and we've increased the number of people who've been insured. I'd say the same thing about Medicaid. Medicaid has been expanded in all but 17 states, and because it's not been expanded in the state of Florida, there are underserved and populations in the state of Florida that are not covered by insurance and therefore denied the appropriate kind of health care. We need to think about that as we go forward and realize that it is our responsibility to care for everyone in the United States, regardless of their race or their economic status. And this is not trying to make a political statement here. This is because of what we in the profession feel very strongly about. We're here, we're in the people business, and that's what we need to take care of.
Thank you, Dr. Zinner. Dr. Tice, I'd like you to weigh in on this. What can be done to get more diversity in providers? I know you're very passionate about this.
Absolutely. I think the solutions are actually relatively clear. I think the decades-long underinvestment in some of the solutions is why we're still having these conversations. So, diversity in providers starts long before, you graduate from your residency program and head into practice, right? It starts with being proficient with your reading level in the third grade. It starts with kindergarten readiness, right? It starts with first in expanding access to secondary education for first-generation college students. And we all have a role to play in that. Those of us in the business sector can certainly step up and support that in our communities at a local or hyperlocal area. And what we're doing, we're partnering very specifically and intentionally with certain institutions, for instance, to ensure that we're building the pipeline. But we're also looking at other organizations, as medical schools and other institutions work to solve this problem. We're beginning to ask the question, what can we do to support you in these efforts, right? If everyone works at the top of their expertise, then it's through those sorts of efforts that the gaps get closed and we actually will see the needle move. It will happen. And I think with continued focus and attention and looking at the data, right, not shifting out of discussion and really moving toward measuring the impact of the work that we do in areas like this, we will slowly see the numbers of minority physicians increase to a level that is commensurate with the population.
Thank you, Dr. Tice. We have certainly gone over so much information. I'd like to take a minute to discuss what patients can do to take charge of their own health. I call that to be empowering. Here are some things everyone should be aware of when they go for a doctor's visit. Know your numbers. My goodness, that's so important. Be a good healthcare consumer. Be informed when you visit your provider. Maintain open communications with your provider. Stay on top of preventive screenings. We've talked about that a lot. Identify resources in your community and at work. I'd like the entire panel to react to this, offer your own advice. I've shared a couple of personal stories of myself that had I not done my colonoscopy, who knows what would have happened. Dr. Zinner, I'm going to start with you. Advice for people, closing thoughts if you don't mind.
I've been in healthcare for well over 40 years. I've never seen anything like what we've gone through for the last 2.5 years. And I've seen people put off their own health care, stay at home, become couch potatoes, and do things that are only going to make things worse as we go forward. And all I ask is that you realize that we're coming out of this now. It's now time to get back to your regular health care. It's now time to get back to your regular diet, exercise, and begin to lead your life like you did 2.5 years ago.
Thank you, Dr. Zinner. Dr. Kaur?
I agree completely. And as I mentioned earlier, I'm very reassured by seeing the influx of patients back in for their annual screenings. But I know a lot of people are still hesitant. I know a lot of people still don't want to come in for various reasons. I know a lot of people, because of the pandemic, for one reason or another, lost their health insurance coverage. And I just want to reach out especially to those people and say there are ways, there are things that can be done, so we assure that you get the screenings and the care that you need, because just like the rest of the panel said earlier, the sooner we catch anything, the better options we have to treat it and for you to live that quality of life that you deserve.
Thank you, Dr. Kaur. Dr. Castellanos.
What I would like to make sure that the viewers understand is that we as providers are doing everything in our power to help reduce the chances of you getting infected with COVID or having any complications thereof. So we're being extremely cautious in the office. You don't see me wearing a mask right now. I'm in my own office, but whenever I go outside, I'm always wearing a mask. So please recognize that we are doing everything possible to protect one another, and it's working. So come out, get your screening, get tested, follow up with us, please.
Thank you, Dr. Castellanos. And Dr. Tice?
Thank you, Olga, and thank you so much for such a wonderful program. We're glad you are here, viewer, and the reason that we're happy about it is because we know that putting the right information into your hands is going to empower you to change your health outcomes. So I would say to you, don't be afraid, be informed, and look around your life and identify the resources that help you achieve your best health. So there may be programs at work, there may be programs in your community. Certainly your insurance company has a vested interest in keeping you healthy. Understand the wellness resources and support services that are available to you. Be sure that if there is a neighborhood walking group or a community gym or other community health effort that you can safely be involved in, that you do that. And remember that you are modeling those behaviors for the young folks that are coming behind you. You are their example of what health looks like. Thank you so much for the opportunity to share this information, and we do wish you the best health.
Dr. Tice, thank you so much. And I was very honest at the beginning of this program talking about a friend of mine who delayed a mammogram. And I'm going to end the program by reminding the viewers that, 2 years later, she now is suffering from stage 2 breast cancer. Our prayers are with her. I know she's going to be just fine. She's in the hands of wonderful doctors at Miami Cancer Institute, but you don't want that to happen to you. Go see your doctor. Go get your screenings. Get your mammograms. Get your colonoscopies. Do what you need to do to stay healthy and enjoy your family. I want to thank our panel. You all have been fantastic. Thank you for your time. I know how busy you are. Thank you for sharing your knowledge and for just being part of this amazing town hall.
Thank you, Olga. It was a pleasure to be here.
Thank you, Olga. Thank you.
Thank you, Olga.
Thank you. We look forward to seeing you guys soon. And of course, we thank you for tuning in. This is the Health Channel and this is PBS. You'll be able to watch this town hall very soon again on the Health Channel, or you can just go to the website allhealthtv.com. I thank you again for tuning in. I'm Olga Villaverde. We'll see you next time. And remember, go see your doctor. Go back, get back on track, stay healthy, enjoy your life, drink a little bit of wine, see those grandchildren, and I wish you all well. Take care.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
South Florida PBS's Health Channel, in partnership with Amy, a free doctor service by VC, the telehealth platform provider for the International Space Station, is offering free telehealth consultations to a limited number of Floridians, and for a limited time only. So take advantage of this opportunity to virtually consult with a doctor at no cost to you now. Just visit allhealthtv.com/free-doctors to schedule your appointment.